restricted to discussing health care. I've had other issues come up. There are other things going on that affect our nation, and you're free to do that if you're called upon. This is H.R. 3200. It's become somewhat infamous. I have read it to get that out of the way. But it's more complicated than that, obviously. The bill has, since it was introduced, think of that as a rough draft. It's gone through 3 committees in the House. Each of them has made individual changes. There are important changes that I've been involved in negotiating, and I'll cover them briefly. Oregon is a state that is a very efficient provider of medical care, and we are penalized because of that. Our reimbursement rates under Medicare are some of the lowest in the nation, and many seniors have trouble finding a physician who wants to take new Medicare patients because of the low reimbursement rate. There are 16 other states in the same boat with us. We're relatively small states, Minnesota, the Dakotas, and others. But we all banded together at the outset because one of the provisions in the bill is to set up a health insurance exchange where people who don't have insurance or are looking for more affordable insurance can go to buy insurance, and includes a public plan option. Now, the public plan option in this draft would have been based on Medicare reimbursement rates. And we said, look, not only is it a problem already for our seniors, but if you create a new plan and you say the docs and the hospitals will get the rates that Medicare is paying today in Oregon, they're going to have insurance and they won't get anyone to see them. So that we drew a line in the sand, and we have negotiated language within 2 years before this bill would go into effect to get changes in Medicare, which means some of the very, very high-cost states that are very inefficient providers of medical care in the East are going to come down, and Oregon and 16 other states are going to go up, and we're going to fix that reimbursement system before we go forward. Just a few more points. We have a system today that's a mixed system. We have 160 million people, give or take, given the bad economy, who get their insurance through their employer. We have 44 million people who are on Medicare. We have about 12 million vets getting veterans care, 3 million people in the active military. We have a number of people in private pay with individual insurance plans. And then we have somewhere between 45 and 50 million people who don't have health insurance. They estimate that 70% of the people who are uninsured are actually working. But many of them are working in small businesses. I ran into a small business owner on my way over earlier this afternoon, and he said that the increase in his insurance rate next year is after struggling in business for 24 years, may put him out of business. So small businesses are struggling, and there are a number of provisions in this bill to help small businesses access affordable insurance for themselves and their employees. There are other problems with insurance other than the cost. I've got a chart here that shows health insurance costs have doubled over the last decade, and they're on a trend to do it again. That would mean 10 years from today, a good policy for a family of 4 would cost about $24,000 to $25,000 a year. There are not many businesses or individuals who can afford that, and that's something we've got to deal with here. So cost is one major factor. There are other problems with private insurance as it's constituted. There's something called prior existing condition, where they will exclude any known problem you have, or they will exclude you altogether from coverage. This legislation would ban that practice by the insurance industry. Something else I hadn't heard a lot about, but came out in hearings this spring, which is really kind of a nasty practice, and it's called rescissions, where people actually have insurance, they've been paying their insurance, and when they get a serious chronic disease like leukemia or cancer, some insurance companies, particularly in California, had special teams of benefit agents they would put on those cases, and you think, well, isn't that nice? No, they're not going on the case to help you get your benefits. They're going to go through your medical record and find a reason to disallow you, and actually were paid bonuses to do that. There was a classic example of a woman who testified for Congress under oath. It's been documented by her physician that she had visited her dermatologist for acne. They said it was skin cancer. She had breast cancer, therefore they disqualified her from coverage and said they wouldn't pay for a mastectomy to keep her and talked to the CEO of the company 6 months later and got that resolved. It shouldn't be that way. This bill outlaws rescissions unless you committed fraud in applying for your insurance. No more of those kind of details. So a couple of other things that I think are very important. No matter how well you think you've provided for yourself, medical care is astronomically expensive. And this would put under all covered people, you would have a $5,000 individual cap under any public or private policy, a $10,000 individual cap for a family on an annual basis, no lifetime limits, which is a little thing hidden in most people's policies that nobody knows about, but there is somewhere probably in your policy a lifetime limit, meaning if you have a catastrophic accident, really expensive care, and you've been paying for the policy for 30 years, they'll say, well, gee, I'm sorry, you used it all up. You had $500,000 lifetime limit. That is prohibited under this legislation. No lifetime limit. Now, the key thing that seems to have generated the most controversy, and after this I'll be quiet, we'll get on to questions, is the whole idea of a health insurance exchange and a public plan option. Now, the health insurance exchange would have 3 levels of benefits: a standard minimum kind of benefit, mid-tier benefit, and then a higher tier benefit. They would all have to be at their base standard. They could add, a private company could add over and above that if they thought they could attract clients or they could afford it, services. But they have to provide a certain level of service at the minimum, at the mid-level, and at the top. So everybody would know what they were buying. But the idea is to try and get those policies offered in a very affordable way, which is the idea of the public plan option, which is to say, here's a policy that covers those same services, and this will be offered at the lowest cost possible to try and get the insurance industry to hold down costs. One thing most people don't know, or so many don't know, is the insurance industry in America is exempt from antitrust law. That means they can and do collude. They get together to just decide what rates they're going to charge, that's legal. They get together to decide what states they're going to sell in, that's legal, or not sell in, what communities they're going to sell in or not sell in, what conditions they're going to exclude or not exclude. All that is legal. It's not legal if you're in any other form of business in America except professional baseball. Since I've been in Congress, I inherited a bill from a wonderful gentleman, Senator William Proxmire. He used to give out the Gold Police Awards, anybody remembers that, but great guy. He introduced this bill the first year I was in Congress, and he I was really interested in it. It turned out no one else wanted to sponsor it in the House. I found out later why, because the insurance industry is not very forgiving of these things. But I co-sponsored the bill. I've reintroduced it this year, and that is, I feel, another way to help keep down costs, and I'm trying to offer that as a member